Injury Description in Medical Legal Practice Part 1. The purpose of injury description is to create detailed and accurate documentation that allows anyone, including non-medical person, to visualize the injury accurately even if they haven't personally witnessed it. The documented details should be sufficiently descriptive to paint a clear picture of the injury in the reader's mind, along with the pertinent information such as the exact location, the type, the disposition, and the color, etc. Objectives for the Part 1 and Part 2 as follows. This is to understand the importance of injury description in medical legal practice, to recognize the house officers or any other medical officer's duty in medical practice, and to apply the knowledge of injury description while completing the relevant forms. Shown here is a case of an attempted manual strangulation with a nail imprint mark and also with a few abrasions and also few contusions. What will happen with the injuries over time? With this remark, let's consider why injury description is important to house officers or to other medical officers. They are the first encounters of the injury. By the time JMOs will come there, you have to mark all the injuries. Reasons are as follows. Injuries tend to heal, or subsequent surgical interventions may have been performed on the injuries. And also the type of injury provides evidence to reconstruct the event and also to ascertain the nature of weapons or weapon used. So you can understand the importance of the proper documentation of injuries. As a result, the duty of a house officer is to mark the injuries over the BHD accurately with enough details so as to be used by forensic specialists or by courts later on. As a result, the injury description process involves several essential steps as mentioned here. Moving on to the first step, first of all, you have to decide the broader category of the injury. It could be an abrasion, contusion, laceration, cut, stab, or a complex type of injury as well. Then it's your duty to think about the subtyping if possible, as I have mentioned here. It could be a linear abrasion. It should not necessary to describe at that point. That means you have to think about the subtyping as well. Second one is the shape of the injury. It is very obvious: irregular, oval, triangle, or quadrangular. Third one is the exact size of the injury. You have to measure it in order to take the maximum length and width in centimeters. The fourth one, it is the determination of the site of the injury. Here we have to discuss more in detail, especially for the part 2, for the part B. A means the gross site. It's very obvious. That means you have to tell the gross site in a way that anybody can understand. You have to avoid as far as possible the medical terms, because we are going to address sometimes the non-medical people during the court hearings. Example, front of the mid-upper arm, back of the lower forearm. Moving on to the 4B, that means specific site, we have to learn it more. Before moving on to the 4B, let's consolidate the points described in the injury description so far. As you can understand here, a quadrangular abraded contusion situated over the front mid-back of the left forearm, measuring 3 into 3 cm in size. It tells about the shape, type and subtype, gross site, and the size as well. And also I want to emphasize that we can interchangeably place these words. No harm in that. It should not necessarily be in the same order. So now we are going to learn about the specific site in detail. If you find challenging to understand during my explanation about the specific site of the injury description, don't worry, as it will become more consolidated with the upcoming illustrated examples. There may be many approaches to describe the specific site. However, based on the practical experience, I have outlined two fundamental methods as there is no direct textbook description to follow. As long as the injury can be visualized even by a non-medical person, while it is being described by its exact shape, color, size, place and disposition, it is acceptable. However, the specific site of the injury should be presented in relation to the bodily landmarks or anatomical parts. There are two requirements that to be fulfilled while attempting the specific injury description. The first one is the selection of a reference point from the injury. As you can see here, now if this is the injury, you have to select a reference point from the injury such as upper border, outer border, lower border, inner border and the center. Once you have done this, then what you have to do is you have to fix this point that you have selected as the reference point in relation with the two perpendicular lines drawn on the body. For that, there are two basic approaches. The first one is using two perpendicular lines to each other situated in the vertical and horizontal directions. The second one is by using a landmark. Let's move on to the method 1. That means here in this case you are going to fix the injury by using two imaginary lines which are drawn perpendicular to each other in the planes of vertical and horizontal directions. Actually speaking, this method is mostly encouraged to be used by students. As you can see here, the selected point of the injury is described relative to the nearby two selected lines that are perpendicular to each other. Vertical lines, horizontal lines. Examples for vertical lines: midline of the body, midline of a limb, outer border of a limb or inner border of a limb. Whereas to that, for horizontal lines, you can use so many other parameters as well. Examples, a joint axis. Now as you can see, knee joint and also elbow joint, wrist joint, vertex, so on. Clear. When we think about the method 2, the first and foremost thing is to select the reference point of the injury. The next one is you have to select a nearby landmark and then you have to fix the reference point of the injury in relation to this landmark. So what are the landmarks that you can use? Examples. Now, as you can see here, you can use the external auditory canal, left and right, outer angle of the right eye or left eye, or the angle of mouth. So these are the landmarks that you can use. And also umbilicus and also inner end of the collarbone. So you can use freely whatever the available at the injury site. Basic steps to injury description 1 to 4 we have described so far. Now we have moved to the fifth one, that is external features and surrounding of the injury. In this case, you have to emphasize about the color of the injury, whether it is scabbed or not, swelling, presence of foreign bodies, oozing or bleeding. The sixth one and the last one is about the underlying features of the injury. There may be associated fractures or underlying hematorosis, hematoma, or hemopneumothorax, etc. Let me allow to apply the points that I have described so far in the following examples. This is an oval-shaped contusion measuring 2.5 into 1.5 centimeter in size, purple in color, and it is situated over the outer and lower one-third of the right leg. Fixation of the exact site by using the method 1, the center of the injury is situated 12 centimeters above the sole and 3 centimeters behind the midline. Detailing of the specific site by using the method 2, here I have to select a landmark. The landmark that I have selected is the outermost bony prominence of the ankle joint. So now I am going to describe by using the method 2. The center of the injury is situated 6 centimeters upwards and 1 centimeter front to the lowest border of the outermost bony prominence of the right ankle. Moving on to the example 2, a 4 cm size semicircular shaped sutured laceration is seen along the middle one-third of the right eyebrow and then it extends downwards and outwards. The inner end of the injury is situated 3 cm right to the midline and 9 cm below the vertex. There is a black eye involving both upper and lower eyelids. This is how that I am going to describe the injury by using the method 1 for specific site. Let's try with the method 2. Here I have to select a landmark. The landmark that I am going to select is the root of the nose. The same description is written here. The inner end of the injury is situated 2 centimeters above and 5 centimeters right to the root of the nose. Example 3. An inverted L-shaped abrasion is noted over the right shoulder joint. The short arm of the L measures 2 centimeters and the long arm measures as 7 centimeters in length and it extends to the right upper arm. The corner of the L is situated 6 centimeters inwards to the outer border of the body and 4 centimeters below the shoulder joint. No surrounding injuries or underlying injuries were noted. Injury description to the specific site by using the method 2. I am going to select a landmark. The landmark is the inner end of the collarbone, like this. So the corner of the L, now this is the corner of the L, is situated 3 centimeters downwards and 15 centimeters outwards from the inner end of the right collarbone. Example 4. An irregularly shaped contusion with a pink upper part and a greenish lower border is situated over the front of the right lower forearm. The size is 5 into 4 centimeters in size. The center of the injury is situated 4 centimeters inwards to the outer border of the right arm and 7 centimeters above the elbow joint. No underlying or surrounding injuries were noted. So the specific site has been described by using the method 1. Let's move on to the second method. Here I have to select a landmark. The landmark that I have selected is the inner bony prominence of the right elbow joint. inner bony prominence of the right elbow joint. The center of the injury is situated 4 centimeters outwards and 6 centimeters above the inner bony prominence of the right elbow joint. Examples 5 and 6 actually have been demonstrated to emphasize another important aspect while describing the injuries. Here, this injury is not necessitated to be described with different planes since it is situated over a bony prominence. A rectangular abrasion measuring 2 into 1.5 centimeters in size, which is the maximum width and length, is situated over the back of the left elbow joint, covering its most prominent bony part, that is the olecranon process. An early scab formation is noted with minimal surrounding erythema. No underlying or surrounding injuries were noted. Moving on to the next image, how to describe this injury. Here, an irregularly shaped abraded contusion measuring 3 into 2.5 centimeters in size is noted over the tip of the nose and extending upwards surrounding the midline. The surrounding area is swollen. No active nasal bleeding is noted. The X-ray nasal bone lateral view indicates an undisplaced fractured nasal bone. The X-ray number is XXXX. Now the emphasis here is when an injury is situated over a bony prominence or a selected point, that we should not try to describe it in different planes. This brings the end of the part 1 of the presentation. To recap the most important points, it is a supreme medico-legal duty to document injuries in a comprehensive manner by all the doctors. Method 1 is more frequently used and encouraged to be used in case of specific site description. And also, please try to avoid medical terms as far as possible. The part 2 further illustrates about the medico-legal histories and also how to fill relevant forms based on the histories that you are going to take. With a lovely acknowledgement, thank you for you as well.